Hola, buenos días, buenas tardes.
Good morning, good afternoon, everyone. Welcome to the press briefing of the Pan American Health Organization, PAHO, on the pandemic of COVID-19 in the region of the Americas. Today is February 16, 2022. My name is Luciana Viegas, Public Affairs Advisor, and I am the moderator. We have interpretation into English, French, Spanish, and Portuguese, and the journalists can ask their questions in either of those or in any of those four languages. You can use the Q&A button to ask questions as well. Thank you very much to journalists who have sent their questions beforehand. Please give your name and outlet when you speak or when you send your questions. Today, Dr. Carissa Etienne, Director of PAHO, will give us an update in her remarks about the number of cases and deaths due to COVID. Dr. Etienne is accompanied by Dr. Jarbas Barbosa, Assistant Director of PAHO, and Dr. Sylvain Aldigueri, Incident Manager for COVID-19 of PAHO as well. Now I invite Dr. Etienne to give her remarks, and then we will have the question and answer.
A very good morning to each of you, and thank you for joining today's press briefing. New COVID-19 infections continued to decline across our region, with a decrease of 31% as compared to the previous week, but they remain very high. Deaths are still on the rise, showing an increase of 5.6% this week. Over the last week, the Americas reported 3.3 million new cases and more than 34,000 COVID-19 related deaths. Deaths have increased for 6 consecutive weeks. In North America, the United States recorded 17,000 deaths, the highest number in the sub-region. Across Central America, countries saw deaths surge after a rise in hospitalizations and ICU admissions. In South America, Brazil registered the highest number of deaths, setting a record for this wave. Also, 15 countries across the Caribbean reported an increase in COVID-related deaths. Hospitalizations grew up to 19% in some countries and territories of the Eastern Caribbean. These trends show that every time infections surge, there is a heavy toll for our families and communities. Peaks in cases have been followed by peaks in deaths 3 weeks later. COVID-19 is a preventable disease, and right now we are losing far too many lives. In fact, COVID-19 has been deadlier in the Americas than in any other region. We have lost more than 2.5 million people over the course of the pandemic. And in the first month of 2022 alone, over 100,000 people died due to this virus. Today, I want to provide some clarity into why we're seeing infections surge and deaths rates climb 2 years into the pandemic. Undoubtedly, Omicron overtook us. The variants spread more quickly than others, and we are dealing with a greater volume of cases than ever before. Unfortunately, as Omicron arrived, we didn't use all the tools that we had developed to slow the spread and prevent infections for the new kind of transmission patterns that Omicron presented. Too many places in our region remained just as they were before this wave. People relaxed their precautions, traveled and gathered and met indoors, often unmasked, creating opportunities for transmission. The truth is that the reduced public health measures were insufficient to reduce the scale of this wave. And now we are dealing with the consequences. A rise in infections is driving a surge in deaths. As we saw throughout the pandemic, the elderly and people living with comorbidities face the highest risk. In every country across the region, more than half of the deaths in this surge occurred in people over the age of 65. But age is not the only factor. Many people in our region remain unprotected against COVID and have yet to receive life-saving vaccines. Unvaccinated people of all ages are still filling up our hospitals and ICU beds, and too many are succumbing to this virus. But today we have better tools to fight COVID, and countries have the experience that they need to control infections. Omicron has shown that the vaccines that we have at hand can protect most of us from severe illness and death. 14 countries and territories in our region have already immunized more than 70% of the eligible populations. We are on track to help other nations reach that mark, and we must continue to strive for equitable access so that we can reach everyone. We have now delivered 100 million doses of COVID-19 vaccines to 33 countries in Latin America and the Caribbean, thanks to the work of PAHO's revolving fund in coordination with COVAX. We are also thankful for donations of vaccines from 9 countries, which have made up to 30% of that 100 million dose milestone. In addition to promoting vaccinations, countries also know how to adjust hospital systems to accommodate new surges while making sure that health workers have the protection and knowledge to safely treat COVID patients. And we know that public health measures like physical distancing, limiting large gatherings, and promoting mask wearing, these measures quickly. We need to activate our response more rapidly to keep pace with the current wave and to stay ahead of future surges of this very fast, very serious virus. And that's why we're urging countries to focus on filling in critical gaps in vaccination coverage. To meet the WHO's 70% coverage target for every country, our region must ensure that at least 20 million more people receive all the vaccine doses. Countries need to focus on expanding coverage in high-risk groups, like health workers and the elderly, to help save lives and to protect hospital capacity. We won't overcome this pandemic unless we protect these groups and then go beyond to cover everyone who is eligible. We must also remember the importance of effective public health and social measures to drive down transmission. We're still feeling the weight of Omicron. It is more important than ever to sustain the public health measures that we know work against this virus. And speed is of the essence because this variant is proof of how quickly the situation can change. You know, inaction is not an option when up to 34,000 people have died from this virus each week during the last few weeks in the Americas. And that means that up to 202 people have died every hour in this region. We know how to slow transmission, to protect people with vaccines, and how to provide better care to those who are sick. We need to act quickly and decisively to save lives. This will not be the last variant, and the future of the pandemic is still extremely uncertain. The choices we make today can have ripple effects for months and years to come. Over.
Thank you very much, Dr. Tien.
Thank you very much.
Empezamos con una pregunta.
Now we go to questions. Now, a question from MMI from Newsweek.
I'm doing a story on the trend of COVID cases in the US this week, seeing as how average cases are down by 75% from this time last month, while deaths are still somewhat on the rise. I was wondering if I could get a comment on that. Why are deaths still so high while cases are significantly decreasing? Do you think we are on a decline overall, or will there be a surge in cases like the one in January? Dr. Aldigueri?
Yes, thank you for this question from Newsweek. I think there are three different questions within the same. So first point, where we stand as of today. And the specific situation of the US can be viewed in the global context. What we can say is that as for previous waves in 2020 and 2021, the European and American regions are currently the most affected areas of a pandemic in terms of number of cases and death. During the first half of February, in the region of the Americas, we have reports of 6.5 million new cases, including over 60,000 new deaths. And your observation regarding an increase in number of deaths despite falling numbers of cases can be made for other countries as well. For instance, the increase in death is clearly observed in both Central and North America. Second point of the delay between disease and delay as per clinical course. In fact, that observation has been made since the beginning of the pandemic in February, March 2020. And specifically, it reflects the duration of the disease in sick people. It may take 3 to 4 weeks or more from disease onset to hospitalization and severe disease and possibly to death. Therefore, the delay in the increase in death compared to the increase in cases is expected and has been observed throughout the pandemic. We do expect death to start declining too, with a delay in relation to cases of 3 to 4 weeks. As the Omicron-driven surge and decline in cases have been so abrupt, the delay is perhaps more striking, but we are not really seeing anything that we have not seen before during this pandemic with regard to this pattern. Finally, the third part of your question regarding future surges. The main characteristic of this pandemic remains the uncertainty of its evolution. This requires caution in our forecast and how we adjust the control measures. Unfortunately, it is possible that we will see new epidemics or large outbreaks, even in areas with high vaccination coverage, especially if new variants of concern continue to emerge and where public health and social distancing measures are dropped at once without careful adjustment. When and where these outbreaks might occur is difficult to advance. So, thank you.
Thank you, Dr. Aldigueri. Pasamos a una pregunta.
Now we go to a question from Folha de São Paulo in Brazil and from Agustín Carosio from Full Noticias Argentina. Samuel Fernandez asks in English.
Regarding the fourth dose of the vaccine against COVID-19, what are PAHO's recommendations for American countries? Is it important to approve this level of immunization? even if only for some population groups, in the current circumstances of the disease in the continent. Dr. Barbosa, perhaps you want to answer in Portuguese, a few words in Portuguese?
Thank you, Luciana. Folha de São Paulo.
Obrigado, Luciana.
So they can get it in a proper way. Seguramente nós temos que
We certainly have to be continuously reviewing new evidences. And we know that the infection caused by the COVID-19 disease, as well as the protection that is given by the vaccines, presently they're limited on a time frame. They start decreasing after 3 to 6 months, and that can vary with the vaccines. So that's why there is a recommendation of having a third jab, starting with the most vulnerable groups, again, because the first objective of the vaccine is saving lives. And if we identify that after 6 months, many of these vaccines that are used start having a reduction in its protection index, it is very important to start vaccinating with the third dose adults, elderly, adults, people with immunological problems, and also people with chronic diseases, so that we can then spread it to other groups in the society. This is a priority that we have for now. The discussion on a fourth dose, I mean, we have to have it, but at the right time, when we have more evidences that we are really going to need a fourth dose, and with what time difference or time interval that we may have that. Brazil has already reached over 70% of the population, 72% precisely, that's fully vaccinated. So this is an excellent vaccine coverage, but Brazil only has 27% of the population that has received the third dose. So we have a large gap, millions of people, and this is not just in Brazil. This is in Brazil, Argentina, and all countries in Latin America and the Caribbean. We have millions of people who should have been already receiving the third dose because they are elderly, because they have chronic diseases, but they haven't yet. So the priority is to identify where these persons are and why they haven't yet got the third dose, and what is the effort that has to be made for that. So for now, we have to analyze scientific evidences that we have so that we can in the future make a recommendation on a fourth dose, who's going to get that, when, and what coverage. Thank you very much.
Tenemos una pregunta desde el Caribe.
We have a question from the Caribbean, Kevin Feldman.
Asks, in Trinidad and Tobago and the Eastern Caribbean, vaccinations slowed significantly, with most people who wanted the vaccine already getting them and taking boosters. The Ministry of Health has been promoting the importance of the vaccine, but battles a wave of anti-vaxxer movements and pro-choice trade unions. How does the country move forward to reach at least 70% vaccination coverage? Director Dr. Tien, perhaps.
Thank you, Kevin, for a really important question. Let me begin by saying that I have no doubt that getting vaccinated against COVID-19 as soon as you can is the smartest thing that a person can do to protect themselves and their community against severe disease or death from what is a terrible disease. All the vaccines that have received WHO emergency use listing are safe. People should have no doubts about their protective effects. We have seen deaths increasing in the region, and the vast majority of these deaths have been among people who have not been vaccinated. And we have continuously urged countries to prioritize the high-risk groups for vaccination and to focus their efforts on protecting health workers, the elderly, and the immunocompromised persons first. As coverage in these priority groups grows, we will see reductions in national hospitalizations and mortality rates due to COVID. The vaccination helps countries avoid continuing outbreaks so their hospitals don't get overstretched and therefore limit care for other conditions. So if you want to avoid getting seriously sick with COVID-19, protect yourself and your loved ones by getting vaccinated as soon as you are eligible. PAHO is working with all of our countries where there is significant vaccine hesitancy, as in the Caribbean, to begin to address this and to convince people that vaccines are safe and that they should take those vaccines. Thank you very much.
Thank you very much, Dr. Tien. We continue with another question from the Caribbean. Susan Graef asks, do you consider that the medication will aid in finishing the pandemic? Dr. Aldeguerri?
Thank you for this question. And that I would use to remind you the fundamentals of the COVID-19 control. And I would repeat a part of my answer to a previous question from Newsweek. The main characteristic of this pandemic is that the uncertainty, and our goal during 2022 is to transition from acute pandemic response to a sustained control. But first of all, the dynamics of the transmission has been and is still amplified through gathering of people, mainly in closed environments, including not wearing masks. Therefore, the adjustments of public health and social measures in a context of community transmission is a key component for the control of the pandemic. The second point is that the vaccination is our best prevention tool. Countries and PAHO are working together to reach clear goals of vaccination coverage, and an optimal coverage will prevent mortality in persons at risk. But along with vaccination, clinical management, and this is the focus of your question, clinical management of cases, according to good clinical practices, is certainly an additional tool to save lives, and therefore to mitigate the effect of a pandemic going forward. During the last 2 years, thanks to the scientific community, we have a lot of evidence on the pathophysiology of the disease, its associated complications, and the clinical management of patients with COVID-19. We have learned a lot. We know how to better prevent and manage the complications using anticoagulants, steroids, other medications as tocilizumab, and use rationally the oxygen. These medications are already available, and the protocols for using them have been updated, and new medications are being proposed and step-by-step validated, including, as examples, monoclonal antibodies and antivirals. So now the health services have a number of tools for reducing the mortality in patients hospitalized with severe disease. Therapeutics is one tool that can help stem COVID impacts. So, as a conclusion to my comments, I would say that while medications have zero impact on transmission and does not end per se the pandemic, it does provide the opportunity to alleviate its consequences and therefore adjust other control measures. I hope I have answered the concerns of Ms. Susan Graef. Thank you.
Thank you, Dr. Aldeguerri. Pasamos a una pregunta desde Venezuela.
Now a question from Venezuela, from Luisa Salomón, from Medio Poder Aminci. She says the pandemic has affected the EPI program, especially in Venezuela. What is the current situation of the relationship between the country and the revolving fund and PAHO. What recommendations do you offer, Dr. Barbosa? Thank you for your questions. First of all, regarding the debt continues to be there, and I think there is an effort by the government of Venezuela. There are funds of Venezuela that are frozen in Europe and in other parts of the world. So an agreement has been achieved between the government and the possibility of using these funds for purchasing vaccines for COVID-19 because it was an emergency. And now work is being done in order to have these funds released to pay the debt. But even if the debt is paid, PAHO continues to work with the Venezuelan government to search for alternatives such as donations of vaccines for Venezuela together with other organizations of the United Nations families, such as UNICEF. We have been able to mobilize vaccinations to vaccinate 8 million children against measles in 2019 in order to control the outbreak of measles. Over 4 million doses of vaccines for yellow fever were also mobilized to vaccinate people in areas at risk. So we continue to work with the Ministry of Health of Venezuela to guarantee that vaccines arrive there. The director last week even spoke about this concern that we all have because during the transmission peaks, we have observed that in many countries in hospitals and health centers were closed. Health staff was transferred to hospitals for emergency, and these and people were not safe and they couldn't go out and get the vaccine. In fact, we had many countries who were affected, and in many countries we have a significant reduction of vaccine coverage in the year 20 when compared to the year 2019. And so PAHO has provided recommendations so the people who provide who administer vaccines can be protected and safe. And also they're helping countries to implement special strategies such as going door to door in order to identify neighborhoods and communities where there is a lower vaccine coverage so that more actively they can update the vaccination status of children. And this is very important and needs to be carried out in order to be able to maintain all the achievements we have in the region as the elimination of polio, measles, which has been eliminated in all countries of the region with the exception of Brazil just at this point in time, and many other diseases which are vaccine preventable and which have a very low morbidity and burden in the region. This needs to be protected, and it is very important that routine immunization programs be fully supported so that children and people in general can be protected. Thank you.
Thank you very much, Dr. Barbosa. Now we move on to a question from Paraguay. We are going to have it live. This is a question by Ariel Acosta from Channel 19. Ariel, I am going to give you the floor for you to ask your question. You have the floor if you can hear us. Thank you very much, Ms. Luciana. The question is the following. How do you see the current situation in Paraguay? Thank you very much. Thank you, Ariel. Dr. Aldigueri. Thank you for the question, Ariel. As in the other countries in the Southern Cone, Paraguay was affected by an exponential surge of Omicron, mainly cases in the first weeks of 2022, and that led Paraguay to have more cases than what they had had related to Gamma. Right now, the situation is in a clear downward trend with the reporting of 50% reduction last week as compared to the previous week. We have very specific information provided by health authorities in Paraguay with a report on the current situation that shares all of this information with the public. Hospitalizations in COVID wards and also in ICUs, I think, what you call UTIC in Paraguay, have also decreased by 20% over the last week after 6 weeks of constant increases. In spite of this, the increase in the number of admissions and death is much lower than with the Gamma wave between June and September last year. As to international travel, Paraguay opened up their borders together with Uruguay and Argentina, and there are very strict controls, but they have no impact at the border regarding the movement of individuals. I would like to highlight vaccination in Paraguay. They have attained 40% as indicated by WHO by December 2021. The most recent reports indicate almost 44% coverage. And PAHO, through its country office and the regional vaccination program, is also closely working with the country to attain 70% based on WHO for June next year, by June next year. But I would like to underscore that even though we have good coverage among the elderly, as well as in other countries, there are still challenges to expand vaccination to young adults, where vaccination proves to be more challenging in terms of communication and how to attain good vaccination coverage. I hope I addressed the question by Ariel. Thank you. Thank you very much, Dr. Aldiguieri. Thank you, Ariel, for this question. We move on to a question by Violeta Villar from the Health Web. She's asking if children can receive their pediatric COVID-19 dose together with the regular vaccines. Thank you. Thank you very much for the question. This is Dr. Barbosa. First, we'd like to say that with the emergency use authorization granted by WHO, we currently only have Pfizer vaccine that is available for children. Moderna and Sinovac vaccines are still being assessed, but our regulatory authorities in the region have reviewed the cases and authorized the administration of vaccines in children who are older than 5 or 6 years of age, depending on the vaccine. Individuals need to follow the recommendation by the national health authorities because they are the ones who reviewed all of the information to vaccinate. But in general, there is a recommendation to wait at least 14 days between doses for the vaccines. This is a general recommendation, but it is well established that if it is the flu vaccine, it can be administered at the same time as the COVID-19 vaccine. So that in general is the recommendation that should be taken into account. That is to say, 14 days between the COVID-19 vaccine and other vaccines, waiting also as we wait also for further recommendations on that topic. Thank you very much. Thank you, Dr. Barbosa. We have a question by Melina Ochoa, and we'll try again to have it live. Melina from UNOTV, can you hear us? I am going to give you the floor so that you can ask your question. You have the floor, Melina. Good morning. Can you hear me? Good morning, doctors. Yes, please, go ahead. This is Melina Ochoa, journalist with UNOTV in Mexico. In Mexico, the Assistant Secretary of Health, Lopez Garmende, communicated yesterday that Mexico has 3 weeks of sustained reduction of COVID-19 cases. He also mentioned that we are also going into a stabilization period. Does PAHO see a reduction, or does PAHO see a plateau in the number of coronavirus cases in Mexico? And the second question is, in the various areas in Mexico, we are administering the booster. In the case of the city of Mexico, this is the third dose for individuals who are 30 to 39 years of age. When should the vaccine be applied again for those who already received the booster? Thank you very much. Thank you, Melina. I think that the first question in connection with the cases in Mexico will be addressed by Dr. Aldigueri, and the second portion of your question will be addressed by Dr. Barbosa. Yes, I will definitely address the first question. And indeed, Mexico has had over the last 3 weeks a reduction in the number of active cases by 62% in 3 weeks. They moved from 208,000 cases to about 78,000 cases. And in addition to that, over the last week, the reduction of active cases is of about 37% from 125,000 cases. It moved down to 78,000 cases, and yesterday they had 21,000 cases, new cases. So we would be in a situation that is equivalent to the situation that the country had prior to the fourth wave of Omicron. So to date, we continue to see a downward trend. However, it would be too early to project for the medium and short term, given the instability at the global and regional level. This would be my answer to the first part of the question by Mrs. Ochoa. Thank you. Thank you. Thank you, Melina, for the question. Melina, undoubtedly, Mexico has made great progress with vaccination. Mexico has about 60%, a little bit over 60% of the total population already vaccinated, but we still need to reach over 70% at least. That is the goal that was established by WHO by June. But I'm certain that Mexico can attain that before June, so that the vaccine can continue to protect individuals, saving the lives of others. So it is also important to guarantee access to the third dose. It is clear, and SAGE with PAHO has already made recommendations. The Strategic Advisory Group of Experts on Vaccines has already made the same recommendation with the same evidence we have. This may change for the various vaccines, but the new variants diminish the efficacy of the vaccine as time goes by. The protection of the vaccines will also be reduced in individuals as time goes by. So the third dose is quite advisable for the elderly, for individuals who have immunocompromised immune systems, individuals with chronic diseases, and all adults, so that they can all be cared for. Now, as to the discussion whether we are going to have the need to vaccinate against COVID-19 and the flu, this is being reviewed. It is too early to say anything about that. And we need to focus on the task at hand. We have a lot of fake news and rumors, so it is very important to show the evidence to people and how full vaccination can save lives, is actually saving lives. And the difference between vaccinated and unvaccinated people in terms of death is quite significant. 68 times higher among, death is 68 times higher among unvaccinated. So vaccination is providing significant protection to everyone. So the debate now is how to reach all of the groups to attain more than 60% coverage, and also to guarantee that everyone receives the third dose based on the schedule that the countries have. This is the recommendation based on the information we currently have, and certainly the evidence is being reviewed weekly to update the recommendations, but always based on solid evidence. Thank you. Thank you, Dr. Barbosa. We have another question from Mexico. Blanca Valadez is asking, experts assert that Omicron BA.2 has replaced BA.1 in many countries because it is better transmitted, and this is what is happening in Mexico, and this is a matter of time in the rest of Latin America. And he's also asking for an idea about individuals who have permanent disability due to invasive treatment for COVID-19. Dr. Aldigueri, I would like to thank you for both questions by Millennium. I am going to start with the genomic surveillance issue and also the variants of concern. Even though in some European countries, in particular in the Nordic countries, Denmark, Sweden, Norway, there has BA.2 has been seen predominantly as a sublineage. We see that in the other countries, BA.1 continues to prevail in 70%, 75% of the samples that have been analyzed in the Americas. We currently see 98% reporting of sequences for BA.1 and BA.1.1, with the sporadic detection of BA.2, which is lower than 0.5% and reported officially in Mexico, Argentina, and Brazil. These are figures from the Americas that have been updated as of today. Many studies are being conducted to analyze differences among those Omicron sublineages and their potential impact on public health, but so far there is no solid evidence that would show transmission capability for BA.2 that is higher than BA.1 or marked changes in its capacity to evade the immune response. It cannot be discarded or ignored that BA.2 may replace the other sublineages in some of the countries in our region. This is continuous adaptation, and this is expected, as I have explained several times over the last 13 months, I would say. However, this does not necessarily indicate an additional cause of concern, given the potential displacement by BA.2 of the other sublineages. Now, as to the situation in connection with the percentage of individuals with permanent disability, I will not share with you accurate figures at the regional level. I think that that is dependent on specific national data, and this is information that can be obtained from specialized publications and sites. But based on recent report, some individuals with COVID-19 have symptoms after the disease phase is over. The symptoms may vary from fatigue up to cognitive conditions and difficulty breathing. There are other aspects beyond these, and this is observed in any individual who has had COVID-19, and this is not necessarily linked to the severity of the disease. On the other hand, we know that patients with severe disease who have been admitted to an ICU may develop health issues related to the disease. The respirator or other invasive treatments that is known as post-ICU syndrome. Since there is no final diagnosis to identify patients with COVID-19 effects, and since evidence is limited, we are faced with the challenge to estimate the magnitude of that situation, as I explained at the outset, to refer to very specific studies that compare contexts that are comparable. Thank you. Thank you, Dr. Aldiguieri. We now move on to a question by Matias Louis. Netscape in Spanish from Argentina. Matias is asking, is there any guideline as to the term that needs to, as to the period of time that has to elapse to receive a new booster? Argentina is recommending 90 days after recovery, but there is no clear consensus on this. Dr. Barbosa. Thank you. Thank you for the question, Matias. Yes, there is no clear consensus because the recommendation will be based on two aspects. First, is it safe to vaccinate individuals after the person has been infected with COVID-19? And also, what is the period when the vaccine may be the most effective? As to the first one, we have a very safe answer. The vaccine is safe, there are no issues, but a vaccine should not be administered when the person is still symptomatic or within the isolation period, so that the person doesn't get vaccinated and then has a chance to transmit the disease to vaccinators or other individuals. After this period is highly safe. The exception is for individuals who were vaccinated, who accepted convalescent plasma and monoclonal treatment, because in that case they need to wait for 90 days because the two treatments may have an impact on the immune system to develop protection once vaccinated. So there are some countries that are issuing recommendations about to wait 2 to 4 weeks, 90 days. That is dependent on the country because the availability of the vaccines is different, and also the situation in which the vaccination of the main groups is also different. But to sum up, yes, the person who has had COVID needs to be vaccinated. It is not true that the person is protected just by having the infection and that the person cannot be vaccinated. It is just enough to see how many thousand cases we have in each country of individuals who have COVID for a second time, because the protection granted by natural infection also diminishes as time goes by. So the vaccine needs to be administered also by those who have been infected by COVID, but not during the isolation period whenever symptoms are present or whenever there was a treatment with monoclonal antibodies. There is a period of 90 days that has to elapse, and in some cases it is 2 to 4 weeks, and it depends on the recommendation by the country. Thank you. Thank you, Dr. Barbosa. We have a question here by Cardenas and other journalists. Henry Cardenas from Panama, in connection with children. Henry is asking, Panama is preparing for going back to in-person classes in March. What is the main recommendation by PAHO to avoid a new outbreak? Dr. Aldiguieri, thank you for that question. And I think that this can also be applied to other countries in the region. PAHO has published very specific recommendations to facilitate safe return to in-person learning. At the school level, the countries may reopen the schools safely by promoting the use of masks and also implementing social distancing, as well as guaranteeing proper ventilation in the schools. High vaccination rates among the population is not a requirement to reopen schools, but we also need to ask parents and caregivers to take their children to their medical checkups so that they are up to date with vaccination. This is an important factor in the vaccination, for the vaccination programs in our country, in our hemisphere. So I hope I have addressed the question by Panama that also applies to other countries. Thank you. Thank you, Dr. Aldigueri. We have a question from Argentina. Francisco Morere, Cover News, is asking, what is your opinion about the decision by Novak Djokovic to make his decision not to get vaccinated public in spite of the fact that he couldn't participate in important matches and also taking care of his body based on his own statements? It's seriously something sad, someone that has access to information, someone who can check all of the information to use an argument like, I want to protect my body, as if this was an individual aspect. First of all, the vaccines are safe and effective. We already have more than 3 billion vaccines administered all over the world in countries that have surveillance systems for the effects of vaccines that are properly established and that they have been working for years. There is also information from the academic sector and the press as to what is going on with the vaccines and the COVID-19 vaccines. There are no doubts. Vaccines are safe, and also they have helped save millions of lives. If we now think as to how the new Omicron variant changed in terms of lethality and how Gamma produced more than 2 or 3 times the number of deaths that we have observed recently. So I think that a person that has so much, the access to so much information to make a decision such as this one, because the vaccine, in addition to individual protection, is also a collective step. We are going to have the possibility to leave the pandemic behind once we reach high vaccination coverage. And then there would be only just a low number of outbreaks remaining for COVID, but this can continue at high levels of transmission if we have a high number of individuals who are not vaccinated, and we can have more deaths and more severe cases. So I think it is very important to highlight. And secondly, I think it is striking for the ministries of health and the health authorities. We need to offer information on a continuous basis. Almost on a daily basis, we see fake news in social media, alleged cases that happened after vaccination. We need to follow each of those cases and also address fake news with truthful information, transparent information that is based on scientific evidence, so that the population can have the certainty that getting vaccinated is important. Vaccination saves lives, and vaccination is also our collective duty to make it possible to recover the economies, the societies in a more expeditious manner. Thank you very much. Thank you, Dr. Barbosa. We now have a question from Nicaragua, Kelly Romero from El Confidencial she's saying that Nicaragua has been reporting an increase in the number of transmissions of COVID-19. Does PAHO know whether this is attributed to Delta or to any other variant of concern? Dr. Aldigueri, in a few words, could you please address this? Yes, in a few words and very accurately, Nicaragua, as the other countries in Central America, has had a peak of transmission over the last couple of weeks, starting in December, with a clear prevalence of Omicron. The sequences that have been reported by all of the countries in Central America show more than 92% of the variant of concern, Omicron. And regarding the information that we are receiving daily also from the Nicaraguan authorities in the publication of sequences, with almost the sole presence of Omicron in Nicaragua. Thank you very much. Thank you. Additional question, which will be in English, and this has been posed by various reporters.
Referring to your statement, you said cases are falling in most countries, and at the same time, many countries are now relaxing restrictions, especially in Europe, for example. Does this mean we are getting to the end of the pandemic? Dr. Tien.
So thank you for that million-dollar question. And it is a question that is often posed by individuals and citizens. So unfortunately, we don't have a crystal ball. And so we really cannot with accuracy predict the future of the pandemic and when it will end. Let's remember that cases may be falling, but they could possibly start rising again. And a new variant may emerge at any time. And therefore, each country should take the measures that they deem necessary to slow down transmission of this virus. So as I said before, it is going to be very important to sustain the public health measures which we know work against this virus. People should heed the recommendations of their public health authorities and do everything that they can to prevent infection. Most importantly, we should get vaccinated. Get vaccinated when it is your turn, and always wear a well-fitting mask when you are around other people, and you need to stay at least 1 meter away from others. And you see, we can contribute to the end of the pandemic. And instead of longing to see the end, we must become active in ensuring that the pandemic can end in short time. So even when restrictions are relaxed, we need to continue exercising caution by avoiding what we call the 3 C's. Stay away from closed spaces with poor ventilation, avoid crowded places with many people nearby, and dodge close contact settings like face-to-face, close-range conversations. So the risk of infection and outbreaks increase when these 3 C's overlap. So protect yourself by not going to crowded parties and evaluating your risk in shopping malls or closed spaces. Wear a mask, and when possible, open windows to ensure air circulation. Wash your hands frequently and don't touch your mouth, your eyes or nose with unclean hands. We've said that over and over again. The pandemic is not over yet, and therefore we must remain cautious, vigilant, and safe. We have seen the Delta variant predominate, and now we are looking at Omicron with a different pattern of transmission. And God forbid, but there may be others. But what we do know is that the same tools work against them. So the best way to fight this and all the variants of SARS-CoV-2 is for countries to continue working to vaccinate all eligible populations, to continue to promote those public health and social measures that can limit transmission. But the end of the pandemic will depend on how well each of us takes precaution and get vaccinated. So thank you again for being here with us today. We will continue to work with all of our member states and all of our partners to ensure that we can reach the end of the pandemic in good time. Thanks again and have a wonderful week.
Thank you very much, Dr. Tien, Director, for those final words. A los colegas, los periodistas, hemos llegado al final de
To our colleagues, we have reached the end of today's session. We are here looking forward to receiving any follow-up question. As usual, as you usually do, you can send it to mediateam@paho.org. And we have another session next Wednesday. And of course, you can send us your questions ahead of time. And we look forward to seeing you again next week. Have a nice week and see you then. Thank you.